Governor Greg Abbott now is deploying resources to parts of the state overrun by COVID-19. And this all comes as Austin public health leaders are now preparing for the future of the coronavirus. APH held a walk-up flu clinic today, and they are planning a drive-through clinic next month. KXAN's Kaitlyn Karmout explains how these clinics are now serving as practice for distributing the COVID-19 vaccine.
We're just making sure that we have all those nuts and bolts in place.
The COVID-19 vaccine supply is expected to be limited at first, so Austin Public Health is planning for the expected high demand.
Also established a vaccine distribution coalition.
The coalition is made up of local healthcare and community partners who will determine the high priority groups, be that critical infrastructure workers or high-risk patients. Pfizer, a pharmaceutical corporation, says we could expect results from its first vaccine trial as early as the first week of November. Austin Regional Clinic is a part of the Pfizer vaccine trial that currently includes thousands of participants across the country.
They believe that they're going to have at least preliminary data to suggest whether it's positive or negative. They will have safety data that will be available probably sometime mid-November. If all goes well, it's anticipated that they may be able to get a rapid approval from the FDA.
The Austin Regional Clinic also expects to start the adolescent portion of the study, which would include ages 12 to 17 by the start of November. The discussion comes at a time when COVID-19 numbers are spiking in western parts of Texas. As of Saturday, the city of El Paso reported more than 10,800 active COVID-19 cases and 572 deaths. This week, the governor announced a surge to send additional medical equipment and 460 extra healthcare workers to El Paso. According to a St. David spokesperson, the Central Texas healthcare system is sending 40 of its employees to assist at its affiliate hospital. Kaitlyn Karmout, KXAN News.
Well, the governor also announcing today a request to use the William Beaumont Army Medical Center at Fort Bliss for non-COVID patients to free up some hospital beds in El Paso for the area hospitals there. Now, hospitals in El Paso right now are also looking at airlifting patients to other hospitals across the state just to free up those beds. If needed, about 20 patients could be airlifted every 24 hours. No word yet, though, on where those patients would be sent.